What if one of the first things you do every morning is quietly putting extra stress on your heart without you realizing it? Millions of people repeat the same morning habit every day because it feels completely normal, familiar, and harmless. But for some people, especially older adults and anyone with high blood pressure, heart disease, or circulation problems, the way you start your morning can matter more than you think. Here's the part that may surprise you. Your body isn't in exactly the same state when you first wake up as it is later in the day. Blood pressure, heart rate, hydration, and circulation can all change overnight, and during those first hours of the morning. That means a habit that seems harmless could have a very different effect at that time. In this video, you'll discover what millions of people do every morning, why cardiologists pay attention to it, who may be most vulnerable, and what you can do differently to start your day more safely. When you wake up, your body is moving from a long period of rest into activity. Your heart rate, blood pressure, breathing, and circulation begin adjusting as you get out of bed and start your day. For most healthy people, these changes are normal. But they can become more important with age, especially if you already have high blood pressure, heart disease, diabetes, or other conditions that affect circulation. Overnight, you also go several hours without drinking fluids. Mild dehydration can make you feel sluggish in the morning, and some people may already have lower fluid levels when they wake. Your blood vessels and nervous system are also adjusting as you move from lying down to standing and walking around. This is why cardiologists don't look at a morning habit in isolation. They consider when you do it, what your body is doing at that moment, and what other risk factors you may have. A habit that seems completely harmless at noon may deserve more caution immediately after waking. And here's where the story gets interesting. Many people don't realize that the first few minutes of their morning can involve several small decisions that affect blood pressure, hydration, circulation, and the workload placed on the heart. The problem isn't necessarily one dramatic action. It can be the combination of timing, intensity, and an underlying condition. So before you change your entire morning routine, you need to understand what your heart is actually dealing with during those first moments after waking. Now think about what many people do the moment their alarm goes off. They wake up, sit up quickly, stand, and immediately start moving as if their body has already been awake for hours. For many healthy people, this causes no noticeable problem. But after 60, the transition from lying down to standing can deserve more attention. While you're lying in bed, blood is distributed differently. When you stand, gravity pulls blood toward your legs. Your body normally responds by tightening blood vessels and adjusting your heart rate so enough blood continues reaching your brain. With age, dehydration, certain medications, or cardiovascular conditions, that response may be slower or less effective. The result can be dizziness, weakness, blurred vision, or feeling unsteady. This is why one simple morning habit matters: getting out of bed too quickly. People taking blood pressure medicines or diuretics may be particularly vulnerable to a temporary drop in blood pressure when standing. That doesn't mean these medicines are unsafe or should be stopped. It means your morning routine may need to account for how your body responds. There is another factor. You've gone several hours without drinking while asleep. Mild dehydration can make the transition harder for some people. If you immediately stand, rush to the bathroom, climb stairs, take a very hot shower, or begin strenuous activity, your body has less time to adjust. For someone already prone to low blood pressure or dizziness, that combination may increase the chance of feeling faint or losing balance. So the warning isn't that mornings are dangerous. The real issue is rushing through those first few minutes while your cardiovascular system is still adapting. A simple change can help. Sit on the edge of the bed for a moment, move your ankles and legs gently, take a breath, and then stand slowly. If you feel lightheaded, pause and sit back down, rather than trying to push through it. And don't ignore repeated symptoms. Occasional brief dizziness can have many causes, but fainting, chest pain, severe shortness of breath, or new weakness should never simply be blamed on aging. These symptoms deserve prompt medical attention. The bigger question is why this small morning habit can matter so much for certain people, and what you should actually do during those first few minutes after waking. Here is the morning habit worth rethinking: jumping out of bed and immediately rushing into activity. It sounds harmless, because you've probably done it for decades. But after a night of lying down, your circulation has to make a rapid adjustment when you stand. Blood suddenly shifts toward your legs, and your body has to increase vascular tone and adjust heart rate to keep blood flowing adequately to your brain. For most people, this adjustment happens automatically, but aging, dehydration, certain medications, and conditions affecting blood pressure can make the response less effective. That's when you may experience that familiar moment of dizziness, weakness, blurred vision, or feeling as though you need to grab the wall. A fall can become the biggest immediate danger, particularly for older adults. So what should you do instead? Don't treat the first minute after waking like a race. Wake up, sit on the edge of the bed, pause, move your feet and ankles, and then stand slowly. Give yourself a moment to notice how you feel before walking quickly across the room. If you regularly become dizzy when standing, tell your healthcare professional. They may want to review your blood pressure, hydration, medications, or other possible causes. This becomes especially important if you take medications that lower blood pressure or increase urination. These medicines can be completely appropriate and beneficial, but their effects can interact with dehydration, standing suddenly, and other factors. Never stop or change a prescribed medication simply because you experience morning dizziness. Instead, report the symptoms so your clinician can decide whether anything needs to be adjusted. There is another morning mistake worth avoiding: immediately starting intense physical activity while you're still feeling lightheaded or weak. Exercise is valuable for heart health, but intensity should match your fitness and medical situation. If you're starting a new exercise routine, build up gradually and follow advice appropriate for your health. And what about drinking water? Staying adequately hydrated can be helpful for many people, but there is no need to force huge amounts of water the moment you wake up. Your individual fluid needs depend on your health, medications, kidney function, heart condition, climate, and activity level. Some people with heart or kidney conditions may have specific fluid restrictions, so general hydration advice does not apply equally to everyone. The most important lesson is that the risk isn't necessarily one dramatic action. It's the combination of standing quickly, dehydration, medications, and rushing into activity in someone whose cardiovascular system doesn't adapt as efficiently. That's why a simple pause can be more valuable than a complicated morning health hack. And don't ignore warning signs. If you repeatedly faint or nearly faint, have chest pressure or pain, severe shortness of breath, a racing or irregular heartbeat, new confusion, sudden weakness, or other serious symptoms, seek medical attention rather than assuming the problem is simply getting older. Your morning routine doesn't need to become complicated. You don't need a special drink, an expensive supplement, or a perfect 10-step ritual. Start by giving your body time to transition from sleep to standing. Recognize symptoms instead of ignoring them, and make sure your medications and health conditions are being managed appropriately. A safer morning doesn't require a complicated routine. The first step is simply to give your body time to adjust. When you wake up, avoid jumping immediately out of bed. Sit upright for a moment, move your ankles and legs gently, take a few calm breaths, and then stand slowly. Before walking quickly or starting your normal activities, notice how your body feels. If you tend to become dizzy when standing, keep something stable nearby for support and tell your healthcare professional. Repeated dizziness can have many causes, including blood pressure changes, dehydration, medication effects, or other conditions that deserve evaluation. Don't assume it's simply part of getting older. It's also important to review your morning medications exactly as prescribed. Some people take blood pressure medicines, diuretics, or other medications in the morning, and the timing can matter for certain individuals. Never change the dose or stop a prescription on your own. If you repeatedly feel weak or lightheaded after taking your medication, discuss the pattern with your doctor or pharmacist. Once you're steady, begin your morning gradually. Drink fluids according to your individual medical needs. Eat a balanced breakfast if appropriate, and avoid immediately rushing into intense activity if you're still feeling weak or dizzy. If you're exercising, build the intensity gradually and listen to symptoms rather than trying to push through them. The bigger lesson is simple. Don't rush the transition from sleep to activity. A few extra minutes may feel insignificant, but they can give your cardiovascular system more time to adapt and may reduce the chance of dizziness and falls in people who are vulnerable. And remember, this advice isn't a replacement for personalized medical care. Your age, blood pressure, medications, heart health, kidney function, and other conditions all influence what a safe morning routine looks like for you. If you've been experiencing repeated morning dizziness, fainting, chest discomfort, severe breathlessness, or unusual heart symptoms, don't ignore them. Get appropriate medical advice instead of simply changing your routine and hoping the problem disappears. Tomorrow morning, don't rush out of bed the moment you wake up. Sit for a moment, move your legs, stand slowly, and pay attention to how your body responds. If you regularly feel dizzy, weak, or unsteady, don't simply blame it on age. Talk with your healthcare professional. If this video helped you understand why those first few minutes of the morning can matter, subscribe for more practical heart health information for adults over 60. And tell me in the comments, do you ever feel dizzy when you first stand up in the morning? Your experience could help someone else recognize a symptom they shouldn't ignore.